This video will show you how to properly administer your Mini-Bag Plus medication by gravity. Please follow all instructions shown in this video. Administering your Mini-Bag Plus medication by gravity at home can be safe and easy with proper instruction. Your home health nurse will be available to instruct you on the procedure following discharge and will visit weekly and as needed for your catheter dressing change and any labs that your doctor has ordered. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water, or a disinfectant wipe, and drying thoroughly as well. Wash your hands thoroughly for at least 20 seconds. And dry as well. Use a separate towel to turn the faucet off. Gather your flushing supplies, the gravity tubing with inline filter, the IV pole, medication bag with medication vial attached, and any other supplies as directed. Prepare both pre-filled syringes of sodium chloride, also known as normal saline, and heparin if indicated, by holding the syringe with the tip in an upright position. Gently pull back on the plunger, then push gently forward on the plunger to expel any air that is in the syringe. Do not touch the tip of the sterile syringe. Repeat with each syringe. Do not touch the tip of the sterile syringe. Inspect the bag of medication for any leaks, particulate matter, and clarity of medication. Check the label on the medication bag for the correct patient name, drug, and frequency. Prepare the bag of Mini-Bag Plus medication as directed by your home health care nurse. Squeeze bag and check vial for any system leaks. Bend the neck of the vial connection to the medication bag up, then down to break the seal. Hold the bag with the vial down. Squeeze the solution into the vial until it is half full. Shake to suspend the drug into the solution. Hold the bag with the vial upside down. Gently squeeze the bag to force air into the vial. Release to drain the suspended drug into the vial. Repeat these steps until the vial is empty of the drug and the solution is thoroughly mixed. Do not remove the drug vial from the bag. Remove tubing with filter from the package. And close roller clamp. Remove protective tab from entry point on the medication bag. Remove the cover from the spike on the gravity tubing and insert the spike into the medication bag using a pushing, twisting motion. Hang the medication bag on the IV pole. Squeeze the drip chamber, filling it half full. Prime the entire length of tubing with the medication by slowly opening the roller clamp and inverting filter until tubing fills completely with fluid. When a droplet of medication is noted at the end of the tubing, close the roller clamp. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. And allow to dry for 60 seconds. Attach the pre-filled syringe of sodium chloride to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with the prescribed amount of sodium chloride as directed by your nurse using a push-pause method. Disconnect the syringe. SASH method. S stands for sodium chloride. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. And allow to dry for 60 seconds. Remove the end cap from the gravity tubing with filter and attach it to the injection cap of your IV catheter by pushing and turning clockwise to secure in place. To calculate the flow rate, slightly open roller clamp and count the number of drops for 1 minute. SASH method. A stands for administer medication. Monitor infusion progress by observing appropriate number of drops in the drip chamber. Monitor flow rate frequently. When the medication bag is empty and drops of medication are no longer seen in the drip chamber, the infusion is complete. Close roller clamp. Disconnect the bag from the injection cap of your IV catheter. If another dose of medication is to be administered the same day, place a light blue sterile cap on the end of the bag using sterile technique. Gravity bag is to be changed daily. You will reuse the bag when administering more than 1 infusion per day. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. And allow to dry for 60 seconds. Attach the pre-filled syringe of sodium chloride to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with the prescribed amount of sodium chloride as directed by your nurse using a push-pause method. SASH method. S stands for sodium chloride. Disconnect the syringe. If your catheter requires the use of heparin, Scrub the hub of your injection cap again with a new antiseptic wipe for 30 seconds. And allow to dry for 60 seconds. Attach the pre-filled heparin syringe to your injection cap and flush the IV catheter with the contents. Sash method. H stands for heparin. Disconnect the heparin syringe. Remove the bag. All supplies and syringes can be double bagged and disposed of with your household garbage. Make sure to wash your hands. Properly administering your Mini Bag Plus medication by gravity at home is important to your safety. In the event of an emergency, always call 911.